Welcome, my alumni friends. Yes, we're back for another week of Facebook Live, and we're going to post this on our YouTube channel for Gateway. What a week, huh? This has been good. We've had so much melting of snow here in Northern Illinois, so I am so grateful for that. This week, our topic is Never Green with Envy. And, Gateway does a great job of taking care of our clients and setting up individual recovery plans and goals. And one thing to remember is that everybody is different. Everybody simply is different in their journey of recovery. And I thought that I'd share a little bit because if you can see the balloon, it's the weekend prior to St. Patrick's Day. And any of you that may remember the downtown Chicago St. Patrick's Parade, man, I don't remember many of those, but that's okay. It's been a long time. And even with the pandemic and what Chicago chooses to do, but it's absolutely a cool experience. Well, I remember the first time I did not drink prior to the parade, and I didn't realize how big that parade was. There were actually people, and not everybody was drinking. So just keep that in mind. Gateway's here for you. We are just so happy to be here at Downers Grove, our brand new outpatient location. And our staff guest is Tim Brown, who is our clinical supervisor for Downers Grove and Joliet Outpatient Services. And boy, we've been chatting quite a bit. He's done a lot of great work and helped a lot of people get their lives back together. So we would like to introduce and welcome Tim.
Hi, Jim.
Hey, Tim. Welcome to Facebook Live. And this is a great opportunity to have you and to show off what's going on with Downers Grove, obviously, and what you're going to do with your services. But I do want to make, before you start, please, anybody that's watching us today, please put a comment on. If you'd like to ask us a question for Tim or myself, or just something that's something you need an answer to, we will definitely be there for you. So anyway, welcome, Tim, and go ahead.
Well, Jim, first of all, I want to thank you for inviting me to take part in this. This is really a great opportunity to kind of highlight where we are moving as an agency. We just had the ribbon cutting at our new outpatient location here in Downers Grove last Thursday. We're actually going to start offering services here on site beginning Monday. And so if anyone is looking for intensive outpatient care for substance use disorder or co-occurring mental health issues, including gambling disorder, go ahead and reach out to us, and we can get you connected to services.
That's great. Absolutely great, Tim. What else would you like to share just about a little bit about your background with Gateway?
Oh, sure. Well, Jim, it all started in a hospital in 1965 on the day I was born. So anyway,
that's good.
Yeah, right. And so, and then from there, I got into the social services based on some volunteer opportunities that I had. I'm a middle-aged man, and so maybe about 10 or 15 years ago. And part of what I was doing was I was working with people within a group setting. And I thought to myself, man, I would really love to do this full time for my career. And so, I decided to do that. So I started working at another agency in Aurora for adults with really chronic mental health type issues in a residential setting, working overnights. And I enrolled in school to work on my master's degree. And I had some really good 3 or 4 hour sessions with the folks who couldn't sleep overnight. And I really learned a lot about people and really how much they taught me as well as how much I can help them. And then the opportunity came up with a job to work in the residential center in Aurora at Gateway. And so I took the opportunity, and I did that for a little over 2 years. And so anyone, if there's any alumni on there who were ever on the co-occurring unit at Aurora, I used to work in that capacity. And then an opportunity came up to switch over to the outpatient side, and then they needed some assistance. They wanted to add some group capacity at our Joliet location, and so I transitioned out there and was there for probably a good 2.5 years doing nighttime groups, right? 5:30 to 8:30 IOP, along with my partner out there. We're running 2 groups consecutively. And about a year ago, I started hearing about an opportunity that Downers Grove is opening up, and my name was being mentioned as helping that process. And so, so here I am. So that's kind of been my journey into social services, and then into Gateway. So I'm very proud of the work that we're doing here, and yeah. So if anyone had any questions, please feel free. And I see some comments coming in. So this is wonderful. Yep. I love this format.
Yeah, definitely. This is from Willis Trotter, who is one of our dedicated alums to Gateway alumni meetings that I host 6 days a week. And he says, "Hey, Tim, thank you. I'm sharing this to a few of my brothers and sisters who are in recovery because these are so important." Thank you, Willis, for sharing. I can tell you that the time that I've had with Gateway for this last year as an alumni director, it's been very, very interesting to determine who's who, right? And the bridge or the extension from residential. Tim, can you share a little bit about that? If we have a client that's actually graduated from residential, how important is outpatient services, or at least to continue with that type of program in their recovery?
Jim, I can't say how. I probably can't express how important it actually is, and to have that support coming out of a residential treatment setting where 24 hours a day you're getting support and services and you're making connections in there, and you're for the most part you're protected, and then to transition after doing a 35-day stay there, now you're out in the world where the rubber meets the road, right?
Right.
And so it's really crucial to have that continuing support as you start to manage easing your way back into where you're meeting life on life's terms, as we like to say.
So that makes a lot of sense. I get questions like that every time I host a meeting or I'm at an event and virtual, and I think you believe this too, based on your training, is that people in recovery need to stay part or glued to some kind of recovery community. And Gateway does a phenomenal job with that, with our 16 different locations and 2 that you're working with right now. I guess what do you think what's your feelings about this last year? I mean, it's been really hard for people isolating. And I know relapse, I hate to say that word, but that's true. Have you had, any experience, or have you seen an uptick of people that have been reaching out for help? Or, I know we can, say, but what do you think about that? What do you think about relapse for people maybe that would love to hear that a little bit about your definition of that?
First of all, regarding this past year, Jim, in case anyone out there doesn't know, we have this new virus going around that's been floating around for this past year. It has, and this goes for the staff, right, and myself included. Everyone is learning a new way of how to cope with what we've been dealing with. And so we really are, when it comes to that, as a Gateway community, we really are all in this together, right? But I will say this: we are seeing an increase in intensity of issues that go along with the isolation. We know that the opioid epidemic is become worse. We're seeing more deaths and overdose. And people are coming to us with increasing amounts of, because of isolation, increasing amounts of anxiety or depression. Not a day goes by that I meet with someone new, if I'm assessing or someone's coming to me for services or us to services, that I had a problem before, but boy, did it become much worse when I started isolating in COVID.
Yeah, and then this continues. I was listening to someone share a little bit about Gateway's, evidence-based practices. Can you share a little bit about, the kind of treatment that we offer? I know you obviously have experience on residential, but treatment we offer in outpatient, is it similar to residential?
Yeah, it really very much is, and necessarily so. First of all, I wanted to say that our treatment really is tailored to the individual, right? And we were kind of talking before we got on camera today how important that is, because it would be easy to say, hey, we're going to write a script and this is it, and everyone just follow the same plan. Well, that's not the way it works. But as far as the evidence-based practices that we begin introducing people to in residential treatment, so people will get exposed to like dialectical behavior therapy or mindfulness-based sobriety, acceptance and commitment theory, cognitive behavior therapy. They'll start learning about the disease aspect of this disorder while in residential treatment. And especially like with DBT and with mindfulness, they'll begin to be introduced to skills. And so now the job in IOP is, okay, based on the skills you've learned, what has been working for you? Have you been trying this out, right? Did you open up the package? Did you take the car for a spin? Have you been practicing this,
like that.
Right? Have you been practicing this in your early recovery? So, yeah.
That's excellent. That's excellent. A number of friends I've had, when I go back to my own personal journey, my own individual recovery, it was a 12-step process for me. But I can recall how I was asked. I guess I had a lot to say, right? And people wanted to hear about my own recovery. And the fact was that I remember going and volunteering, which I think any of you alumni, if you want to volunteer and connect with me or Tim or any of our coordinators throughout the chain, because we want to hear from you. We want to hear about your story. We want to know how you're actually doing. And what I was taught early into this, and I think you probably can agree with me, Tim, is that there was the necessary time of outside of treatment. And what do you do? And I heard that last night with an alumni check-in about the current clients were simply asking some alums, which is an internal thing we do virtually. And they were asking, what do I do when I get out? How do I move back home? Do you have any advice for, like you said, the rubber hits the road, right? So how do we continue to do that together in recovery?
I think that it's important for individuals to really, as they're starting to get their feet wet again, right, out in the world again, it's hugely important to engage in the supports that are being offered, and whether that's IOP treatment, whether you're following up in 12-step work and working with a sponsor, which is, by the way, which is critically important for people as well, is to have that support, right? And so, to kind of drill down on that, Jim, how do I communicate with people, right? What do I do when I get invited to a family event, right? Which I know may be high risk. And here's how I kind of approach that with my clients, with the people that I work for. Allow yourself, right? Allow yourself to feel awkward for a while, and that's okay. Talk about it. Rather than what you're used to, maybe isolating and not talking about it, and then, get it out in the open, discuss it in groups, discuss it with your support structure, and just acknowledge that in many ways, your first year in recovery is going to be just that. It's going to be a year of firsts.
So 1 year in recovery, I go back, I think I remember just simply going back to my home group, and I actually would never commit to another person to be a sponsor and on the outside, but I was able to develop a relationship with about a half dozen men in my first year. And I started to listen. I started to hear what people were saying and sharing about their disease. And that was an acceptance. So you think that is it a cure-all for this disease? Or is it something we have to continue to live with?
Well, Jim, the unfortunate news where we're at with the science behind this disease is that it's something that is learned. It's a disease of the brain. It's like learning to ride a bicycle. A pathway is developed. It becomes ingrained, entrenched in the brain. And it is essentially a permanent pathway. And it works by, I don't want to get too technical here, but you're really kind of barking up my tree here. I could probably go, let me go.
That's good.
Who's willing?
We want to hear from Tim.
Who's willing to stay on for another 3 hours? It basically is this. In the way the pathway works is this. It's not so much just the use, it's those things that are associated with the use that spark this pathway into action. And so it's a lifelong process of recovery. The good news is the recovery process, when you're talking strictly as a medical point of view, is that memory can get reassigned, although it's still there. And so we can work on developing other pathways. And so the active work of engaging in mindfulness practices, right? We just did in my group this week, we did a 20-minute mindfulness meditation exercise. And if we actively engage with that, if we actively engage in creating pros and cons lists, engaging our frontal lobes, we can work around that. So the good news is recovery is treatable. I mean, the addiction or substance use disorder is treatable. We know that. And it's a holistic approach. it's individually tailored, right? And so we're talking about never agreeing with envy, like, this person is doing this, work what works best for you and based on who you are and what you value. So, but it should be holistic.
Yeah, I agree 100% because I have no counseling or clinical background. I have experience though by sponsoring or being sponsored and working with that recovery exactly and calling out the disease. And when you listen to other people's stories about that, they think, oh my goodness, I don't want to tell anybody I'm an alcoholic or I'm an addict or something like that. And I said, it really doesn't have to be shared. It's your story. And keep that in mind. Number two, whatever you need, you'll figure that out as you take one day, right? One day at a time in your own story, your own life. And I do think that the people I've gotten to know that I actually went to meetings with a long time ago. And when you see people that are still in recovery, oh my gosh, what is so and it's incredibly been hard this year, right? Because we haven't been able to see each other face to face, or if we did, it's with a mask and so different things. But I find recovery is such a gift and such a blessing for us. And I think it's an awakening. And that's exactly what you just shared. So I appreciate that, Tim. That is so great. So great. We don't have, we don't have any other questions or comments at the moment. We had Willis come on, which was great. Tim, do you have anything else you'd like to share before we wrap it up?
Well, no, other than I want to thank you for this opportunity to talk about the services that we're offering in Downers Grove. We continue to offer in Joliet, Aurora, and other sites throughout the state, as well as other areas of the country. So I'm excited to talk about it, but it's also a somber time because we know the services are needed. And so we're here to help. Definitely.
And that's a good segue into our Gateway Connect Alumni app. Oh my goodness, please download this free app through Google Play or through the Apple Store. People that our alumni are taking advantage of this. They have books, we have videos, we have mindful exercises, there's stress exercises. There is a lot of posting of people that were treated together for any of our facilities. So please download it, just gatewayfoundation.org, and go ahead and download that. And you'll connect with me. You'll see my video as you come on, and or anything that we're doing for an event or meetings. It's on the app. So in addition to our website and through our social media outlets. So next week, we have Brittany Yoddard. Thank you both for your time and knowledge. Thank you, Brittany. We appreciate your comment. You don't realize how much that means to us. Sometimes we wonder virtually when are we making a difference, I think we are for sure. Well, anyway, next week it's going to be a solo gem, and we're going to talk about we have a way out. Think about that one, huh? We have a way out next Friday, and we'll continue to work with the recovery themes and to stay focused on your needs. But again, Tim, thank you so much for coming on and bringing us back to getting us out of our remote locations. And everybody, please enjoy St. Pat's weekend and St. Pat's, and everybody have a wonderful time with your family. And we are going to see you next week. Have a good weekend. Thank you.